That's Rahat Fateh Ali Khan there, the beautiful voice of Rahat, I should say. You're listening to Indus here on BBC Radio Lancashire. Now, it's difficult getting to the surgery at the best of times, but imagine if you could speak to your doctor over Skype. Well, a GP in Manchester has launched a Skype patient consultation project, and he says it's delivering great results. Let's find out more from Dr. Sarfraz Hussain from the Mossad Family Medical Practice. Welcome to the programme.
Thank you, Donna.
How are you? You're right.
I'm fine.
Now, we've all been using the internet and cameras speaking to the family, so what made you think this would work for your surgery?
First of all, it's not actually my idea, it's the patient. And the joys of being multicultural is that people have family or relatives abroad. So Skype is a technology that is widely used in the community. One patient of mine fondly told me that since he came over here, he's actually got closer to his mother. And today being Mother's Day, I thought I should mention this. And I asked him, how's that? And quite simply, he said, well, what I do is I work on the computer. I'm a IT designer. And I put Skype on. I put my mum in the corner. She's there in the living room. She's watching their version of EastEnders, and I ask her what's going on. She potters back with a plate of food. I ask her what she's eating, and he leaves it running. And I thought that was a great idea, that you could communicate with this. And with it becoming more widespread, we decided to try it out. And since we put a camera onto our a computer, what I found is that when I would be talking to a patient over the phone, I asked them if they have a Skype account. Often they do, and I can convert that into a Skype chat, and that has many advantages. To give you an example, one patient, he had back pain. He can't move, doc, it's hurting too much. And because he had Skype on his phone and laptop, he told me, I was able to see him, I was able to chat to him, I was able to see how well he could bend his back, and I was able to give him the best solution for his problem at the time.
Right, so do you offer diagnosis on all sorts of illnesses over Skype, or is there a danger that you may not pick up something?
Well, this is in the pilot stage, and we are a cautious bunch in the medical profession. We usually like to tread down well-trodden paths. Skype is relatively new. When I say that, it's actually been established quite a long time. In the medical field, it's not been taken up as much. The cornerstone of any GP consultation is face-to-face, and it's built upon the patient and the doctor knowing each other. When you have a patient that you know, sometimes it's easier, for instance, if you want to give a blood result, to give them a telephone call and tell them the news. Even this can have pitfalls. One particular lady that springs to mind, I rang her to tell her results were normal. And I said, oh, good news, your results are normal. The phone went silent. I heard a bit of sobbing, and I said, oh, are you all right? Are you crying, or have you just choked on something? She said, well, if it's normal, then why have I got my symptoms? Something like that. If you could see the person, you actually know what their face is showing, so you automatically start probing. And whereas on the phone, you don't have visual cues, and as a consequence, you often can misrepresent what a person may be thinking and go down the wrong track.
So that's interesting. So it's all about looking at their face, seeing the environment they're in, and picking up on, as you said, those visual cues, really, isn't it? Yeah. But what about medical guidelines? Are you allowed to do this?
Like I said, we are a cautious bunch. We never go down an avenue without really thinking it through first. So the first question when I came across this idea from a patient was, well, is it secure? Our records have to have a certain level of protection, and our consultations have a certain level of confidentiality. The GMC is very keen on this, and we like to practice best medicine. So after a conversation with the IT department, we looked around to see if any other practices were running this, and to our surprise, actually no other practice is running this. So we looked further. There was a government review a few years ago that looked into Skype and its safety in the NHS. Their conclusion was that this is a safe medium. It is secure. It guarantees patient confidentiality. The footnote or the small print that they put in was that it should only be a dial-out service, whereas a normal Skype-to-Skype communication is two-way. They recommend that it should be a GP dial-out.
Right, so the GP would dial the patient as opposed to the patient trying to dial in and...
That's right. For your listeners who might not be aware, our computer systems are N3, which means that they are separate from other computers and they have quite a lot of security attached to them. Someone dialing in may not get through, but we can dial out. Secondly, it's not like a telephone. If somebody dials in and the doctor or somebody, we're not paying attention to it, it can ring without and be unnoticed. So for safety and patient good clinical governance, what the guidance recommends was that it should be a dial-out service.
Okay. So is Skype being used by other GPs?
Like I said, we before we embarked on this, we looked around to see if we could piggyback upon any other surgeries. We are a cautious bunch. We never go into a new technology without really thinking about it first. So we looked to see if any other surgeries are doing this, and if we could borrow their protocols, because then the hard work is done. Unfortunately, we didn't find that, which in some ways...
So it's quite unique to your surgery then?
It is unique at the moment. I'm hoping it will pan out, and this is why we're calling it a pilot. If other surgeons had done it before, then it wouldn't be a pilot. And for the reasons of the pilot, what we're doing is keeping a very close log of our consultations and then learning experiences from it as to the best way to get the best out of it. And so far, it's been very positive. Patients who have been had a Skype consultation love it. They absolutely love it.
And I suppose also the patient's at ease because they're at home, aren't they? So they don't have that trepidation about, seeing the doctor and I don't know what's going to be happening to me if they diagnose something, horrendous. But, I mean, when they're in their own home, they're a little bit more relaxed, aren't they, really?
They are more
relaxed. You can get better idea. Is that the idea?
They are more relaxed, although I must say I'm very good at putting patients at their ease when they're with me as well.
Good bedside manner, that's what.
Well, it's an important thing. The thing of interest that I found quite useful is that we can access via the phone, via Skype, certain groups of patients that perhaps were excluded before. You can't really take a conversation with a child over a telephone. Children are not very patient with phones, but when you see a child on Skype, they are more willing to engage. Same goes for the elderly. People think elderly are averse to technology, and maybe they are. They don't like to press the buttons, but once you got it up and running in front of them, what you find is that actually they respond better than a simple phone call, because a phone call is very limited in its content, and for an elderly person sometimes their hearing isn't as good, and they like to look at the face and look at facial cues. So actually Skype consultation has a great advantage than our ordinary telephone consultations, because it can reach and access patients that perhaps would not necessarily be good candidates for the phone.
Now, things like rashes, for example, I mean, is that easily detected on what type of rash via a camera, or would you suggest that they come in to be checked?
So far, with rashes, I prefer patients coming in, but there is an important point here. Not that long ago, there was swine flu, which sometimes can have rash, but usually has a temperature and other symptoms. And there's a great scare about that. The scare was that here is a disease that could potentially be so infectious that healthcare professionals should be protected. And if you visit a patient, you have to wear a pinny, gloves, face mask. Skype technology offers a way of assessing a patient very safely. Without really having to pinny up and glove up. I mean, we still may need to physically touch the patient, but it's far superior than a telephone consultation. If you look at the learning over the past few years, one of the things that happened in Skype, which was shocking to all of us, was that there was a child who died in Stockport because they were suspected to have swine flu, so they were not brought in, and as a consequence, they had something else. Now, if the doctor had been able to see the patient, then we are very good at detecting an ill child, because you can look at a child and think, I don't like the look of this. But on the phone, they don't talk, it's the parent talking. And if the parent is inexperienced, they don't know. So tomorrow, if we have the next bird flu or we have the next big pandemic that is so severe and significant, as a doctor, I would like to have Skype. And I like my patients to have it so that I can safely triage them and give them the best advice possible.
Right. And finally, do you think that this is the way forward then?
Technology moves on. Years ago, I used to use internet dial-up. Now I use broadband. If I had to go back to dial-up, it would feel so antiquated. Having used Skype and then having to rely on just as a phone call actually feels to me like a backward step. So I am perhaps a forerunner of this, and because I've experienced it, I'm very keen. Other doctors at the moment, they have their reservations, and rightly so.
And what sort of reservations are there?
Well, we don't know if it'll work. What's the added advantage? Does it take longer? Does it actually make us, does technology, is the technology reliable? Does it mean that actually it'll increase our workload? There's lots of concerns, and hence why I think I said at the beginning, we're a cautious bunch. We've piloted this first. We've kept it in the control of the GP, i.e. myself and the other doctors in the practice, and we've looked at it very carefully as to when we're using it. First of all, safety. And secondly, that it is actually improving what we do. I'm quite convinced that it is improving what we do. It is safe, and we deliver better care. And most importantly, patients are better off for it. It is an improvement to them.
And of course, from the patients, they feel it's quite positive. A positive move. And would it save on sort of, booking appointments, or would they have to ring up to say, we'd like the doctor to call us, please? Is that how it would work?
Currently we're operating a booking system. If you imagine what my day is like, from the moment I walk into the surgery to the moment I walk out, every 10 minutes of my time has been slotted. So it's not possible for me just to take a call just like that. The receptionists book everything. So it would be booked in one shape, form or another. And that is how we get ourselves to be as productive as possible.
Right. Okay, well, thank you very much for coming in. That's Dr. Sarfraz Hussain. Traffic and Travel is next.